Good morning. My name is Van Laskoski. I'm the Public Information Officer on the Emergency Management Team here at Stevens County Hospital, coming to you with our update on March 27th, 2020 regarding COVID-19. Real quick, I'll give you a brief overview of our emergency management team. It's made up of several members of our hospital staff. We meet 2 times every day, and all we talk about is COVID-19. Once in the morning, once in the afternoon, and we are working quite literally around the clock to make sure that we're as prepared as we can possibly be for this virus. We're also meeting once a week with all of the other regional hospitals. All of these meetings take place, of course, via phone conference, but we are in regular communication with our emergency management team and our regional hospitals to collaborate on resource pooling, on protocols and procedures, and I just wanted to mention that. Real quick, our testing statistics so far in our hospital and our clinics, we have tested 19 individuals for the virus. 9 of those results are still pending. We've received 10 of those back negative, so we still haven't received any positive results for patients we've tested in our facilities. I have received a lot of feedback this week about who's getting tested, how many have you tested, how many of you quarantined without testing, and I'll real quickly talk on that. That's something that we're not going to give a regular statistic of just because it takes a lot of time to explain it, but I will tell you right now, we have seen 24 individuals in our facilities who have been symptomatic. 19 of those have been tested. The others were very low risk, low probability, but we like to err on the side of caution. So if they're low risk and low probability, we may not test those individuals, but we will still err on the side of caution and advise that they quarantine at home. As long as you adhere to that, as long as you quarantine at home for those 14 days after we've told you, you really do minimize your risk for exposure to the community. That is the CDC recommendation, and we are following CDC recommendations to the letter. There are 11 other individuals who we've also advised to quarantine. These are not symptomatic individuals, but they are individuals who maybe called us and said, hey, I flew on a plane, I'm not feeling sick, but what should I do? Those individuals, we are also explaining that it's better to err on the side of caution and to quarantine at home. So just a brief overview of what we've seen overall, and I hope that answers some questions. We are really working hard to expand our testing capabilities, but testing supplies are in very short supply, regionally, statewide, nationwide. So please understand we are working very hard to get more resources for testing. I mentioned yesterday that we have put Anna Krummenacker as our point person for donations. If you want to make a donation to the hospital, we really welcome that. It's been so great to have this much support, and we've seen so much outpouring of donations of supplies, of meals, of financial donations. We really appreciate that. If you want to make a donation, call 706-282-4410. Just an example, today, Bulldog Car Wash, really thank you guys, donating lunch to our radiology department. And just so many individuals and companies have reached out and offered their support. We really, really appreciate that. This is as challenging a time in healthcare as we have ever seen. So I just want to reassure everyone we are doing everything that we possibly can to combat this virus. We appreciate you tuning in, and we will be in touch. I will not be posting videos over the weekend, but I will be posting them beginning again next Monday. So be safe, practice